Hello everyone, welcome you all to another valuable free session of Movement Maestro Academy. Today we are going to discuss on the topic Principle of Injury Prevention in Sports. For this session, we have our beloved research person Dr. Nihar Mohanty sir, who is now continuing their PhD at Guru Nanak Dev University, Amritsar, Punjab. Welcome you, sir. Without wasting our time, let's start today's session. Over to you, sir.
Thank you, Dr. Pradyut sir, for this platform. Thank you for this opportunity. We will start the session for today. So I am sharing the slide. So for the today's session, the topic is Principles of Injury Prevention in Sports. So the topics we will cover in this session are, first one is Introduction to Assessment and Diagnosis. Second is your general history taking in sports. Third is general examination in sports and prevention of sports injuries principles. So basically, types of sports injuries are acute or chronic, macro trauma or micro trauma. It is soft tissue injury or hard tissue injury. It is minor, moderate or serious, or minor or major. Both are used synonymously. So now, before going into detail, we should know common sports injuries that include sprain that involves the injury to the ligament and joint capsule, strain that involves the injury to the muscle and tendons, joint injuries, most common are knee joint, shoulder joint, ankle joint, and sometimes spine, muscle tear like commonly hamstring, adductor muscles of thigh, these are commonly turned out. Dislocations are most common in mobile joints due to some assault or collision. Fractures, it can occur in any bone depending on the collision, depending on mode of injury. Achilles tendon injury, that is your tendocalcaneum injury, that can occur due to eccentric forceful contraction of the gastrocnemius muscle, and pain along the shin bone, that is shin splint, which is most common in general sports. Now switching to the accurate diagnosis, we should have the accurate diagnosis idea what will benefit the individual sports physiotherapist. We should know first, it enables the clinician to explain the problem to the sports person and natural history of the condition to the athlete, who will want to know precisely for how long he or she will be affected. So we should explain, we should know the problem, the history, then only we can explain exactly how much time he or she will be in rest and how much he or she suffer. A patient may present with an acute knee injury, but the diagnosis of anterior cruciate ligament tear has markedly different implication from the diagnosis of minor meniscal tear. So, though the pain is at the knee joint, it is acute knee injury, but the conditions, that is, one is anterior cruciate ligament injury, and another is minor meniscal injury, that should be diagnosed properly. Next is, it enables optimum treatment. Numerous conditions have similar presentation but markedly different treatments. For example, switching to the example, we should for example, patellofemoral joint syndrome and meniscal tear, hamstring muscle tear and referred pain of the hamstring muscle, that is from the lumbar spine. Though the symptoms and signs are same, but the conditions are different. So we should thoroughly examine first, we should thoroughly assess first, then only the treatment, that is optimum treatment, can be given. It enables optimum rehabilitation prescription. For example, rehabilitation after seen pain due to stress fracture will be more gradual than that after identical seen pain due to chronic compartment syndrome. So seen pain is the only symptom, but again, conditions are, one is stress fracture, another is chronic compartment syndrome. So rehabilitation program is also different for both the conditions. So we should exactly diagnose first, then only we can plan the rehabilitation program. Now, making a diagnosis, key points for accurate diagnosis are follows. First is whether the symptoms are of musculoskeletal origin. We should first decide the musculoskeletal origin is the main cause, whether the symptoms are from originating from the musculoskeletal origin structures. Second is possible local causes of patient symptom, whether any local structure is involved, that should be taken care of. The site of the pain, that could be referring pain to the site of the symptom. The root cause of the pain should be taken care of. The relevant kinetic chain, that is when, for example, the back and the lower limb in the shoulder injury of a tennis player. Next is biomechanics about the particular sports. You should know, being a sports physiotherapist, how, for example, in cricket, the bowlers, how their biomechanics is, the batsman, how the biomechanics is, you should know thoroughly, and other possible causative factors like metabolic diseases or nutritional deficits. Now, the history taking, the steps you should follow while taking the history. First is, history remains the keystone of accurate diagnosis. It will provide the diagnosis in the majority of cases. The following principles need to be considered when taking a history. First is, you should allow enough time to the patient or sports person, and same time you should allow yourself to be patient enough to listen the patient. Listen the condition, what the patient is suffering. Be a good listener. You should have that much patience to listen the patient properly. Know the sport. You should know exactly about the sports. For example, you are treating a hockey player, you should know about the hockey game. You are treating a volleyball player, you should know exactly about the volleyball activities and skills. Next is circumstances of the injury, how the injury occurred, whether in climate, whether in collision sports, or in sudden jerky movement. You should know the circumstances of the injury and obtain an accurate description of the symptoms. Allow the patient, allow the sports person to clearly describe the symptoms he or she has. An accurate description of the patient's symptoms is essential. Common musculoskeletal symptoms include pain, swelling, instability, and loss of function. These are 4 common musculoskeletal symptoms. One is your pain, swelling, instability, and loss of function. You should know exactly what is happening to the patient by asking the patient thoroughly. So first is pain. We know all about the VAS scale, that is visual analog scale. The scale is 0 to 10. When there is 0, it is no pain. When 1 to 3, it is mild. And when the grading is 4 to 6, it is moderate. And same time 7 to 9, it's severe. And when it is 10, it is very severe. Patient will not allow you to touch the part, allow you to come closer to that part, because the patient is already in severe pain. So consider the characteristics of the pain the patient is having. We know all about the different characteristics of the pain. First is location. Exactly note the location of the pain. A detailed knowledge of surface anatomy will enable you to determine the structures likely to be involved in producing the pain. So you should, being a sports physiotherapist, being a therapist, you should know exactly the surface anatomy or superficial anatomy. If the pain is poorly localized or varies from side to side, consider the possibility of the referred pain. Then that means when the pain is not localized properly or it is varying from one side to different side, you should think of about the referred pain or origin is different and the symptom are different. You should consider that. Second is onset of the pain. Speed of onset helps to determine whether the pain is due to an acute or overuse injury. So onset helps you to know exactly whether the pain is acute or it is due to overuse injury. Was the onset of pain is associated with a snap, crack, tear, or other sensation? Sudden crack, the pop-up sound in any sudden movement gives you idea about the ligament tear. Someone suddenly crack sound, sometimes it gives idea about avulsion fracture. So you should know about the onset. Next is severity. It may be classified as mild, moderate, or severe. Assess the severity of the pain immediately after the injury and also subsequently. Was the patient able to continue the activity? You should ask the patient whether he was able to perform the activity, normal functioning immediately or not. If he denies that he never stood off, that means the severity of the injury is very much or it is severe. It is not mild. Next is your irritability. This refers to the level of activity required to provoke pain and how long it subsequently takes to settle. The degree of irritability is especially important because it affects how vigorously the examination should be performed and how aggressively the treatment should be. So it is if the pain is irritating particular patient, so you should take proper care for the treatment. If it is mild, then you can gradually treat the particular patient. Next is nature of the pain. This refers to the quality of the pain. It is important to allow patient to describe pain in their own word. Always ask the patient to describe the pain in their local language or in their regional languages. And you should, being a physiotherapist, you should understand the minimum local language or regional language to understand the patient properly. Next is behavior of the pain. Is the pain is constant or intermittent? You should find or you should see the behavior of the pain, that is constant or intermittent. What is the time course of the pain? You should know that. Is it worse on waking up in the morning or does it worsen during the day, that is activity, or does it wake the patient at night? That means night pain. You should thoroughly know the behavior of the pain. Next is radiation. Does the pain is radiate at all? If so, where? You should find the location of the pain, origin of the pain, and where it is radiating. You should know thoroughly. Next is aggravating factors of the pain. Which activity or posture aggravates the pain? That should be taken care of. Simply sitting is aggravating or some activity is aggravating the pain. That should be taken care of while doing assessment. Whether the particular posture is generating the pain or particular posture is relieving the pain, that should be taken care of while assessing the patient. Next is relieving factors. Is the pain relieved by rest or the adaptation of the certain postures? Do certain activities relieve the pain? Is the pain affected by climate changes? For example, in cold weather, you should find these relieving factors. You should ask the patient thoroughly during assessment of the pain. Next is associated features. These include swelling, instability, sensory symptoms such as pins and needles, tingling, numbness, and motor symptoms such as muscle weakness. So associated features you should thoroughly examine, that is your normal swelling, instability due to injury to the supporting structures, sensory symptoms like pins and needles, tingling or numbness due to involvement of the nerves, and motor symptoms due to motor nerve involvement. There is muscle weakness, gradual due to misuse of the muscle. Next is previous treatment. You should ask the patient about the previous history of the previous treatment he or she has taken. What was the initial treatment of the injury? Was the ice applied? Whether the RICE protocol or PRICE protocol followed or not? RICE protocol mainly. That is our basic your icing, immobilization. All these things are taken care of or not? Was the injured part immobilized? If so, for how long? What treatment has been performed and what effect did that treatment have on the pain? Whether it reduced the pain or the pain was normal or pain aggravated by the treatment. You should thoroughly ask the patient. Next is swelling examination. Immediate swelling following an injury may indicate a severe injury such as fracture or major ligament tear accompanied by hemarthrosis, that is blood deposition. So when there is sudden swelling, you can suspect a fracture or major supporting ligament injury. Record the degree of swelling, that is mild, moderate, or severe, and subsequent changes in the amount of swelling. Whether it is constant, or it is increasing, or it is subsiding gradually, you should see. Next is your instability. Any history of giving way or feeling of instability is significant. Try to elicit the exact activity that caused this feeling. So ask the patient to perform particular movement to see the instability of the particular posture. You should ask the patient, or you should reposition that particular joint to see the instability. For example, in throwing, the feeling of instability occur in the cocking phase or the follow through. These are the phases in the throwing biomechanics: cocking phase and follow through. Being a sports physiotherapist, you are very much acquainted to these terminologies. Next is function. You should examine, access the function also. It is important to know whether the athlete was able to continue, whether he is able to continue with some restrictions, or he or she is unable to continue. So this will give you idea whether the condition is severe or mild. Next is history of a previous similar injury. If the sports person has had a previous similar injury, record full details of all treatment given, response to each type of treatment, how he or she responded, his or her body responded to the particular treatments, whether any maintenance treatment or exercises have been performed following initial rehabilitation. Previous injury is a major risk factor for recurrence. I repeat, when there is previous injury, the recurrence to the same injury is very common in sports persons because already the supporting structures are weakened up. The rehabilitation goal might not have achieved properly. So the recurrence is very common when already the part is injured previously or in past days. Other injuries, like past injuries, may have contributed to the current injury. For example, an inadequate rehabilitated muscle tear that has led to muscle imbalance and a subsequent overuse injury. Because of importance of spinal abnormalities as a potential component of the athlete's pain, the patient should always be questioned about spinal symptoms, especially pain and stiffness in the lower back and neck. So always thoroughly ask about past injuries to know the associated risk factors, associated cause of the present injury, and always examine the spine. Don't spare spine. Always examine the spine since it is the main structure that involves, that helps in locomotion and skillful activities in the sports. So any sports, your spine is involved. So always thoroughly examine the spine. Past or present injuries in the body parts that may or at first seem unrelated to the present injury may also be important. For example, a hamstring injury in a throwing athlete can impair the kinetic chain leading to shoulder, alter throwing biomechanics, and thus contribute to a rotator cuff injury. If the patient or the sports person is having history of hamstring injury or hamstring strain, he or she may get rotator cuff injury due to kinetic chain abnormality in future days. So you should thoroughly rehabilitate the root cause, that is hamstring injury or hamstring strain, by which he or she can avoid the future rotator cuff injuries. Now the general health. Is the patient otherwise healthy? The presence of symptoms such as weight loss, general malaise may suggest a serious abnormality like a tumor. It must be remembered that musculoskeletal symptoms are not always actively related. So always think about the tumor or any malignant conditions. Don't treat immediately. Always thoroughly assess the patient. Never skip this tumor and all. Work and leisure activity also predispose to pain. Okay. So work and leisure activities can play a role in both the etiology and subsequent management of an injury. For example, a patient whose job involves continual bending or forward bending, or who enjoys gardening, may aggravate his or her low back pain. Though he or she is enjoying the gardening, but he or she can aggravate his or her low back pain. It is important to know about these activities and to ascertain whether they can be curtailed or minimized. It should be taken care of. Consider why the problems have occurred, why the problem originated, why it happened. So predisposing factors should be considered not only in overuse injuries, but also in medical conditions and in acute injuries. In an athlete suffering from exercise-induced asthma, symptoms may occur only during important competition if there is an underlying psychological component. Alternatively, the asthma may occur only at particular time of the year or at a particular venue if allergy is present. So exercise-induced asthma can occur when the psychologically the patient is weak in competitions, or environment, the pollen grains or any irritant is irritating the nasal tract or producing allergic reaction. It can produce exercise-induced asthma as well. So first you should rule out whether it is the psychological factor or it is environmental factor. An athlete with an acute hamstring tear may have a history of low back problem, or alternatively, a history of a previous inadequately rehabilitated tear. Recurrence can only be prevented by eliminating the underlying cause. So always underlying cause should be ruled out prior to the treatment. If you will not resolve the root cause, you will not give the patient proper rehabilitation. You should be that much clear while assessing the patient. Now the training history, you should take the training history. In an overuse injury, a comprehensive training history is required. This is best done as a weekly diary, as most sports persons train on a weekly cycle. It should contain both the quantity and quality of training and describe any recent changes in the environment of training. Note the total amount of training, that is your distance and hours depending on the sports, and training surfaces like it is turf or it is grass, it is sand or it is hard surface or road. You should, or hilly area or mountain area. So training surfaces should be taken care of. While assessing, continual activity on hard surfaces or a recent change in surface may predispose to injury. So you should keep in mind while assessing the patient about the surface where he or she is getting the training recently. In running sports, pay particular attention to the footwear. We all know good footwear protects the individual, and as well as it improves, enhances the performance in sports. So for both training and competition shoes, note the shoe type, age, and the wear pattern. Record recovery activities such as massage, spa, sauna bath, and hours of sleep. All these things you should thoroughly examine and assess and ask the patient to tell. Equipment, you should consider about the equipments they use for particular sports. Inappropriate equipment may predispose to injury. For example, a bicycle seat that is set too low may contribute to patellofemoral pain, because when it is too low, the knee is in loading, the patellofemoral joint is in load, that causes repeated, that is overuse, causes pain, or it initiates the patellofemoral pain. So the biomechanical and consideration should be taken care of while using the equipment. So inappropriate equipment should be avoided. Appropriate equipment should be used while doing any sports. Next is technique. Patients should discuss technique problems that either they or their coach have noted. Faulty techniques may contribute to injury. Any skillful activity or any sports is having the particular technique. So it should be perfect one. Otherwise, it will cause overuse injury and it can cause other deformities or any complications in time to time basis. For example, a wristy backhand drive may contribute to extensor tendinopathy at the elbow. Very commonly, it is called extensor tendinopathy, that is your tennis elbow. It is quite common in wristy backhand drives. So it should be taken care of, and the trainer or the coach, and being a sports physiotherapist, you should find the faulty technique and correct them. Overtraining. Next point, symptoms such as excessive fatigue, recurrent illness, reduced motivation, and persistent soreness and stiffness may point to overtraining as an etiological factor. So overtraining should be avoided. Proper rest, proper rehydration should be taken care of while doing the sports or training. Psychological factors should be taken care of. Injury can be caused or exacerbated by number of psychological factors that may relate to sports, like pressure of impending competition, or may concern personal or business life. The clinician needs to consider this possibility and approach it sensitively. Sometimes very sensitive, some sports persons are very sensitive, they even attempt suicide. So very sensitively or very closely you should monitor, you should ask, don't be rude, rather you should accept, you should believe the patient, and very sensitively you should handle all these situations. Nutritional factors. Next one, inadequate nutrition can predispose to the overtraining syndrome and may play a role in the development of musculoskeletal injuries. In an athlete presenting with excessive tiredness, a full dietary history is essential. Not only training and surface or any faulty techniques only causes the injury, rather nutritional factors plays an important role in maintaining or doing good performance. So it should be taken care of. Proper dietary plan should be there for every individual, every sports person for performing particular sports. History of exercise-induced anaphylaxis. This one is very unique one. Exercise-induced anaphylaxis and food-dependent exercise-induced anaphylaxis are rare but potentially life-threatening clinical syndromes in which association with exercise is crucial. This is a clinical syndrome in which anaphylaxis occurs in conjunction with exercise. Given the rarity of the condition, our current understanding relies on the case studies only. So only case studies we have. Detailed research is needed for this condition. Next is determine the importance of the sports to the athlete. You should know why the particular athlete is playing that particular game. Whether he is playing for the job, whether he is playing for the country, whether he is just playing for the passion. You should know about his mentality, the level of commitment to the sports, which will not necessarily correlate with the athlete's expertise, has a bearing on management decisions. Sometimes management decide. Be aware of the athlete's short and long-term future sporting commitments to schedule appropriate treatment and rehabilitation program. If the patient is for only 3 months in the camp, then you can't complete the 6-month program of rehabilitation. So accordingly, you should plan. If you are posted at a rehabilitation center, being a sports physiotherapist for 1 year, but rehabilitation program required for particular patient is, for example, intermittent basis 6 months, again training and 6 months. So you can't complete. You should know exactly how long the patient or the player is here, how much he is efficient, how much committed he is towards his sports. Next is general examination, how you examine. The points are develop a routine examination protocol. Always routine checkup or routine examination should be there. Where relevant, examine the other side. Always sound side and affected side should be examined. Consider possible causes of the injury. Always consider the possible causes. You should know what could be the possible causes. Attempt to reproduce the patient symptoms. You should reproduce the patient symptom to know exactly how much pain he or she is bearing. assess the local tissues for the local involvement, assess for the referred pain, for the nerve involvement, assess neural mechanosensitivity to see the mechanosensitivity, mechanoreceptors, all these things you should assess. Examine the spine, never forget about the spine. Though you are having back pain, you always see the spine, but if you are having shoulder pain, you also know you should examine the lumbar spine as well. Biomechanical examination of the particular sport should be taken care of. You should know the biomechanics of every sports. Then only you can examine according to the sports. And next is functional testing. Functional testing should be advanced one. You should ask the patient to perform particular sports skill, a particular technique to see whether he or she is able to do or not. Now, last one is prevention of sports injuries. How you should, what are the protocols you should follow being a sports physiotherapist to avoid the sports injuries? First is develop a fitness plan that includes cardiovascular exercise, strength training, and flexibility. This will help decrease your chance of injury. So always plan cardiovascular exercise, strength training, and flexibility. Alternate exercise different muscle groups and exercise every other day. Alternate exercising a different muscle group by which all the muscles can properly be trained and overuse of particular muscle group can be avoided. Cool down properly after exercise or sports. It should take 2 times as long as your warm up. Always focus on warm up and cool down along with workout or your training. Never skip any one from your routine. Never skip cool down, never skip warm up. It will cause injury. It will risk you to the injury. Stay hydrated. Drink water to prevent dehydration, heat exhaustion, and heat stroke. So always stay hydrated. Never ever give your body or keep your body in risk. Never deplete the energy, rather always rehydrate. Stretching exercises can improve the ability of muscles to contract and perform, reducing the risk of injury. Each stretch should start slowly until you reach a point of muscle tension. Stretching should not be painful. Aim to hold each stretch for up to 20 seconds or maximum 30 seconds. Use the right equipment or gear, protective gear, or wear shoes that provide support that may correct certain foot problems that can lead to injury. Learn the right technique to play your sport or particular sports. You should know, it should be skillful to avoid any overuse injuries. Rest when tired. Never be a heroic activity. Never perform a heroic activity. Rather, always take a rest when you are feeling or the patient is feeling tired. Avoid exercise when you are tired or in pain. Always take your time during strength training and go through the full range of motion with each repetition. Always complete the range of motion. Never ever do exercise in mid-range. Rather, complete the full range of motion. If you do sustain a sports injury, make sure your participant is adequate rehabilitation before resuming strenuous activity. Always complete the rehabilitation protocol. Always complete the rehabilitation program before asking the sports person to come back to his normal sports. Never compromise. Otherwise, you are pushing the patient again to the injury. Recurrence is mostly seen when the rehabilitation is incomplete. So always focus on the rehabilitation, complete rehabilitation. Thank you. Thank you for this session. Thank you for the patience. Over to you, sir. Thank you, sir.
Thank you, sir, for sharing your valuable knowledge with everyone on sports injury prevention. Hope in this short period of this session, everyone can able to collect lots of informations regarding sports injury and about its prevention. Thank you everyone for joining today's session. And thank you so much, sir, again for sharing and giving your valuable, precious time with us. Thank you, everyone. Good night.